While I was unable to find disciplinary action cases from the state of Florida in which I reside, I found the state of Louisiana to have plenty of open and closed cases. These cases consisted of anywhere from drug and alcohol abuse to inappropriate relations with a client. The most common among the cases reviewed was the prevalence of inappropriate client relations. I personally was astonished by the number of cases involved with this violation. Many of the themes presented throughout these cases is the fact that among all of those cases presented, only a few licenses were revoked regarding COUC violations in this profession, as well as the fact that many of those with such client relations chose to reside from their current profession. Many of these cases concluded with suspension or voluntary surrender. The case chosen was among the state of Louisiana versus Natasha Monique Wilson. This case identifies that Ms. Wilson engaged in sexual relations with a client throughout the duration of their counseling sessions. This is in direct violation of the Code A5A and the rules and regulations appointed by the ACA Code of Ethics. This code states sexual and/or romantic counselor-client interactions or relationships with current clients, their romantic partners, or their family members are prohibited. This prohibition applies to both in-person and electronic interactions or relationships. This is found on the ACA Governing Council and on page 5. In the state of Louisiana, this violates the Code 1312, Section E. This code states sexual intimacies with current therapy client patients. Psychologists do not engage in sexual intimacies with current therapy clients or patients. Professional occupational standards, and this can be found on page 28. This is seen to be a matter that should not be taken lightly both by the state of Louisiana and by the American Counseling Association. There are many instances in which those that have crossed that boundary are in fact justly dealt with. In this specific case, Mrs. Wilson had to surrender her license. Among the identification of wrongdoing within the state of Louisiana, those that dealt with the counselor impairment were also recognized. Impairment among Louisiana is seen through the same general lens as the ACA Code of Ethics, and the fact that those having hardships or facing those hardships may remove themselves for the time being to reevaluate and reassess their mental health. They are also encouraged for counselors to come to terms with such triggers. As stated, licensees are alert to the signs of impairment from their own physical, mental, or emotional problems and refrain from offering or providing professional services when such impairment is likely to harm a client or others. They seek assistance for problems that reach the level of professional impairment, and if necessary, they limit, suspend, or terminate their professional responsibilities until such time it is determined that they may safely resume their work. This is found by the Professional and Occupational Standards on page 36. This is in direct correlation with the code C2G of the ACA Code of Ethics, or impairment. Upon reviewing these codes, the question I have is, do those facing impairment feel stable enough to return to work after such triggers arise, or do they fully resign in the hope of establishing overall wellness? Thank you so much.